everybody. I'm Farron Mather. I'm the Engagement Manager with United Way Central Alberta. Welcome to the first GenNext Central Alberta Community Talk Series, where we will be having conversations with local community agencies and leaders to see how they are coping through these challenging times. So GenNext encourages people in their 20s and 30s to become involved with United Way, to more fully understand the issues that confront people in our region, to actively connect with the community, and to influence positive change through meaningful volunteering and networking opportunities. So today, we have GenNext Central Alberta co-chair Lauren Allard, chartered professional accountant at MNP, and we will be chatting with the executive director, Christine Stewart, from the Canadian Mental Health Association. So the Canadian Mental Health Association and United Way have a long-standing relationship. They have been one of our original funded agencies, and we cherish this relationship that we've built over the years and the important work that they are continuing to do in the community. And I'm now going to pass it on to Laura, who's going to tell us a bit about GenNext and what we're up to.
Thank you, Farron. I am proud to be co-chair of the GenNext Central Alberta Cabinet. Our goal is to engage millennials and to grow our community, collaborating with all generations to be able to learn about the social issues along with the assistance of CAPRA to learn more about the poverty issues that are affecting Central Alberta. We did plan to have a spring social event, but as you understand, we have changed our approach now to what our current strategy is, and we're focused more on going virtual with the GenNext CA Community Talk Series. Our goal has not changed. If anything, this virtual environment has actually provided us with more opportunities to further expand our network and to reach out to even more of our community. We will be continuing to have these virtual discussions with various agencies that partner with the United Way Central Alberta. And we hope to connect these agencies to people that want to learn more, access their services, and who may also be in a position to assist in any capacity that is needed. We're excited to start this talk series with Christine Stewart from the Canadian Mental Health Association. So thank you so much for being available today to talk with us and so we could learn a little bit more about your agency. So I'll pass it over to you, Christine, so you can explain a little bit more about the Canadian Mental Health Association.
Awesome, thanks, Laura. Yeah, we're excited to partner with the United Way. As Farron said, we've had a long relationship there and have had so much support, and we're so grateful when we're able to return that favor as well. And again, I encourage people to give to the United Way. The government is now matching dollar for dollar, and so it's there's never been a better time to give. CMHA has been in Central Alberta for 55 years, providing a variety of program options. We tend to kind of flow with what the community needs at any given time. And so, of course, our programs and services have changed over the years. Right now, we offer mental health supports through courses, through support groups. We have a crisis counselor. We have a systems navigator who kind of helps people if they just don't know who to call or where to go. How to fill out forms. She even assists people in person when she can, just as a support person. A variety of things. We assist people in housing if they're struggling with homelessness. Yeah, quite a few. We have a brain injury program as well right now. So a lot of options for people just to ensure our vision at CMHA is that of mentally healthy people in a healthy society. And as you can imagine, there are a lot of ways that we can assist to meet that vision. So we're always open to innovative ideas and new ways to assist people.
That's wonderful. Thank you for sharing that information as well, Christine. We do have some questions for you that the GenNext Central Alberta Cabinet has prepared. So the first question that we have is what types of situations does the CMHA Crisis Center encourage people to reach out?
This whole COVID-19 thing is brand new, of course, and we've been rapidly scrambling to make sure that we can provide services to people while still keeping our staff and participants safe. But we've been very fortunate in that we have the technology to do a lot of things over the phone, over computer. So our crisis counselor is still taking calls until 8 p.m. Every night, 403-342-2266. You can call there and access her. As well, our systems navigator, prior to this, all of her work had been done in person, but she has had a lot of calls with people that are very confused about the financial situation right now, how to apply, what they're eligible for. So she's done some quick learning on that so she can assist people through that process. We've also fortunately received funding through the United Way and the Red Deer and District Community Foundation to have a small bit of money set aside for those individuals who are really struggling financially and don't qualify for some of these government supports, so that they can get food, transportation, assist with some medical expenses, those types of things. Because what we are finding is people are panicking right now, and there are many people who fall through the cracks. So the ability to assist them in any way has been tremendous. And then our educational courses and support groups, they have been on hold while we figure this out, but they should go live next week. And our support groups actually started 2 weeks ago. And we have had a really successful response to people needing those supports.
Thank you. That's absolutely wonderful, everything that you are still able to continue to offer during these challenging times. And you're right, there's definitely an increase of the panic type of people panicking during these times. So thank you for offering the information on those services that are available to people that are feeling those ways. Another question that we do have for you is, at what point should people be reaching out to CMHA?
Well, my message is usually, if you think you need help, you probably already waited too long. People always think they don't need anything. They can push through, it'll be fine. And what we find is that once you wait too long, then you start taking it out on your family. You start losing sleep. Your anxiety gets so high, it's hard to level it back down again. So I strongly encourage people to just reach out. It doesn't have to be a significant crisis to warrant a call. We're available. We have staff available. Just call in and touch base. All three of the programs that I mentioned will happily just touch base with people. And people have a different comfort level depending on what their need is. But like I said, we have the crisis counselor. Sharon is our systems navigator as well, who will just talk through a problem. She's really good at helping you problem solve. If you're just so overwhelmed, you can't focus on what to do next. She's great for that. And then Vicki in our education program, she's phenomenal. She's doing a lot of one-on-one supports for people who are isolated. A lot of people, I guess, were released from hospital because they had to clear spaces for the COVID patients they were anticipating. And so there's people that were potentially receiving mental health services in hospital who aren't right now. So she's providing that type of support to them too. So like I said, when in doubt, just call and we will assist. People are struggling with depression, anxiety, stress, family issues, of course, have escalated due to this. Domestic violence is increasing. Any of that, just call.
Thank you for clarifying. That's wonderful to hear the different ways that people could be affected and how they can approach their individual situations. So thank you again. So this is kind of in line also with your last answer, this next question, but which mental health scenarios do you expect to see an increase in with the self-isolation measures to combat COVID-19?
Well, we've really anticipated, as I said, and I think people have heard the reports of an increase in domestic violence, but also I think there's an increase, like, you know, parents and struggling with their kids who might also have mental health issues. It's difficult when you now are home 24/7 together. You don't have the external support of a teacher or friends or colleagues. Trying to get through the homework scenario, it just magnifies all of those family tensions. You know, two spouses home together 24/7 that have never spent that kind of time together. It's just a different kind of tension. Another thing we've seen a lot of is, you know, even people whose lives haven't changed drastically, it just feels stressful in the world, you know. You drive around and see people in masks, or, you know, a lineup outside Costco a mile long, and it's impactful. And sometimes we forget, we don't give ourselves the room to feel okay about our stress level, and accept that this is normal response to a very frightening time. So yeah, people's depression can go up, anxiety can go up, isolation is significant for people. Finances are dramatically impacted, and people are worried about things that they've never had to worry about before. Finances, food, how they're gonna, even your health care. I mean, you have to be able to qualify that something is a health crisis before you can get seen for certain things. I know somebody waiting on surgery. She can't have the surgery till she has a dental review, and you can't get a dental review because it's not crisis dental work. But without the dental review, she can't anyway. It's just like, it's complicated. So we just, everything's just magnified during this time.
I heard this, I've seen it a few times floating around social media, and it's a tweet that says something along the lines of how we're all experiencing a sense of normalcy mixed with a sense of urgency or emergency, and how unnatural that is for people. So have you kind of experienced some of that as you're navigating with your clients? And
absolutely. I mean, my staff have told me that even the people whose day-to-day lives haven't changed a whole lot, you know, if you were already, say, unemployed and at home or receiving AISH, and you already had some social anxiety, so you didn't go out a ton, there's still a lot of anxiety because the whole world is in crisis right now. And we haven't experienced that in our lifetime, most of us. And so it is just, your brain can't quite wrap around all the facts and the details. And so even for people who normally don't struggle with feeling mentally well, I mean, we're all going through this right now. And I think it's hard to remember sometimes how people who have ongoing mental health issues, how much more impactful that can be as well.
Mm-hmm. Absolutely. Thank you for that.
Yes, thank you. The next question that we have for you, Christine, is how does the CMHA utilize the United Way funding to help people during this pandemic, and how has your agency been affected by COVID-19?
Well, I mean, I'm very grateful because we already had funding through the United Way. They're one of the biggest funders of our crisis counselor / systems navigator positions. And so thanks to United Way, we already had those services in place. And during this time, I don't know how we would be able to support people without those positions. And we have a couple of other funders in there as well, but the United Way has been a big piece of that. And then the additional funding that we've received recently, and I think there will be more opportunity down the road. We have that NMAX fund that United Way was able to partner with NMAX to set up. That's been a huge benefit to people. Right now, people aren't getting disconnection notices per se, but they are getting behind. And the people have called stressed about it. Normally, we wouldn't help until someone's electricity or gas was getting disconnected, but we're able to, we got to change things a little bit right now to make it work for people. And then also, like I mentioned before, we've had people calling who are just crying and desperate because they have no food in their house, or they can't get anywhere safely because they have a medical appointment or something, or they can't go get their groceries. So helping with transportation. We did have one individual who had prescription expenses, and because they no longer had employment, they couldn't pay for that. So we were able to assist. So like I said, it's kind of a case-by-case scenario, but any of the funding we're receiving from United Way right now is going to those types of services to support people.
That's great. It's, you speak a lot about how this is affecting everybody in different ways. And I feel like you've hit on a lot of the points that could definitely be reaching home for a lot of the individuals that will be connecting to this information. The last question that we have is the one that we get to find out what we as a community can do to help.
I think the biggest way to help is, if you know someone's struggling, please send them to us, right? Like I said, we've got that parent support group that is going on and is fantastic. We'll have some kind of one-off courses that we're going to offer just about, and very specific to our times, how to handle working from home every day, how to handle the stress of COVID-19 in a changing world. Those kind of themes will be coming forward. So we'll make sure those are shared out. But also, people have been fantastic in their donations, but our huge request at this time would be, if you've got any extra dollars and wanted to, forward a grocery card, or, money for cab vouchers, or, even some McDonald's cards, that type of thing, we make sure to get them in the hands of people who are really struggling.
Awesome. Thanks for providing those examples as well, because we want to be able to make sure that we who can help are able to help in the ways that will actually benefit what it is that you're seeing a need for.
Absolutely.
So yeah, thank you.
Thank you.
Thanks again for taking the time today to teach us a little bit more about the Canadian Mental Health Association and how your agency is helping in this environment.
Thanks for having us and allowing me the opportunity to share a bit more about what we're doing and more ways that we can help the people in our community.
Yes, thank you so much, Christine, for joining us today. I loved what you said about just those simple cab vouchers or gift cards. It's just those tangible things that people can do when they're out. And I know that there's people out there that truly do need it. So thank you so much.
And thank you also, Farron, and the United Way Central Alberta, and all of the GenNext Central Alberta cabinet members to be able to make these series possible. I also just wanted to thank everybody that is tuning in on social media, because without everybody participating and sharing this information to get it out to our expanded network, these ways to help would not be possible. So thank you very much. Just wanted to also mention to stay tuned. Next week, Dennis O'Dwyer, my co-chair for GenNext Central Alberta Cabinet, will be reaching out with the next series talk that will be happening next week. And please follow us on social media. There will be some information on how you can do that, as well as information on how to access help now if needed, and some important phone numbers relating to mental health assistance.
Great. Thank you so much, and see you next week.
See you next week. Thank you.